Hello, and how are you? Welcome to our session today. My name is Winnie Barawa, and in this class, we are going to check around the different or working environment in fragile and conflict affected, where we are focusing more on the vulnerable settings. So, as healthcare providers, at some instances, we are presented to work in humanitarian environments or environments that cater for the vulnerable and conflict affected population. And this class is going to explore, not really much in details, but to just introduce us into the vulnerable setting and the humanitarian work. And if you're a person who is working with such organizations, which could be the UN agencies that varies from the UN refugee agencies to the environmental agencies and all that. This is a class that can really be beneficial to you, and any healthcare provider that also is either in their learning state or is planning to work with the humanitarian setups. Welcome and stay with me till the end. So let's introduce first what the vulnerable settings and populations basically means. So when you're looking at a vulnerable population, we are referring to individuals who are at greater risk of poor physical and social health status. In general, we are exploring on the population that actually is disadvantaged in comparison to the dominant population in the society. So this simply implies that the disadvantaged subsegment of the community whom are considered to be vulnerable because of disparities not only in physical, economic, and also in the social health status when you compare them with the dominant health populations. So if you look in any country or in a given community, we understand that people are mostly stratified or put in a strata based on the economic status, based on their physical status, and also based on the social status. Based on economic status, it goes without say that majority we are stated either as poor, middle class, or the high class stratifications. But when it comes to physical, you can have state of children, women, elderly, the adults. You also get to have cases such as persons with disability or people who live without disabilities. When it comes to social status, we also look at state of family. Let's say a good example is children who are orphaned or widows and widowers. We also look at social status of parenting. Is it single parent? Is it child-headed parenting or families? So these are the status that you can use to bring disparities in terms of individuals based on either physical, economic, and the social health status. So when we compare individuals or people or the population based on such stuff, then you can have a sub-segment that we cater for that we call the vulnerable population. And this can be exposed by different factors that could be happening in a community. Maybe it could be war, could be divorce or high divorce rates, could be unrest in a community or conflicts, crisis, and so on. So let's go ahead and see which population actually makes up the vulnerable population according to so example of the vulnerable population that we have in our community, we talk mostly of the infants. So these are children under 1 year. We also have children who are within the bracket of 0 to 5 years. And then we have disabled individuals, elderly, and the frail. There's also the category of mental retardation or people who have mental instability. There's a case of patients who are in crisis, and an example could be the sickle cell crisis or any other illness that presents with a crisis like a state like hypertensive crisis and so on. And the other examples could be confined inmates or people who are in prison are part of vulnerable population. We have also refugees. And with refugees, this one we look at it from external refugees who are moving in from other countries to different countries. But we can also have internal displaced persons. There are also refugees, but in this case, mostly we refer to them as internally displaced as opposed to the word refugee. So if you been looking at the difference between these refugees mostly are considered to be coming from other countries and settling in a different country, but where we have a population having been displaced in their own country because of crisis, wars, or situations that are unrested, then we call them internally displaced, which are also part of our vulnerable populations. And then we have immigrants or individuals who are in different countries because of different purposes. Could be they migrated from one country to another. Doesn't necessarily mean because of refugee status. It could be due to other roles like looking for work or greener pastures. And so when you exist in that country, you'll be treated as an immigrant because you're not originally a national of that country or state. So in cases where someone finds themselves working in a vulnerable population, I love using the refugee state when you're working because among the list here, they're like the most vulnerable of them all. Because the other places are more controlled, more catered for, and they're easy to understand the guidelines. But for the refugee cases, most of the time it's unplanned, does not have a system on how to settle, and so there are so many assessments that come out for the people that are catered for in there. So what are the areas that we can do an assessment for when you're dealing with a vulnerable setup or vulnerable populations? You can handle maybe medical and surgical conditions where you may be prescribed to give medical or surgical treatment and management depending on the disease. A majority come around with injuries and very chronic illnesses because of the poor hygiene or poor setup, the war-like environment which comes with a lot of damage and so on. And then the other bit we can look into is assessment for suspected abuse or maltreatment for the particular group. Because of the unrest, there's high risk of insecurity, and majority of people can get abused or ill-treated in such a case. There's also neurological status assessment. This is from the aspect of injuries. Maybe you can say there are certain damage that ended up damaging the nerves of the neural supply, and therefore you have to assess such. There's also psychological and mental status. In the case of social disadvantage, you could find that some situations mentally affect the person, and in this case, may be forced to present them for therapy or group management and mental health assessment to just ensure they're stable enough and they're able to be settled down mentally. The other bits that we can assess includes ability to meet activities of daily living. This goes more so to the elderly and the frail, those who are weak and are in need of total care. Then you may be guided to provide support and total management in terms of helping them with daily activities of living. And then you can do the general physical assessment. This could be head to toe, could be systemic assessment to identify any abnormalities or pathophysiologies that are presenting with our patients. And with that, then you're able to identify different diagnoses that each of the patient maybe we are assessing could be presenting with. And number 7, there could be assessment for suspected nutritional or functional risks. And this comes about because of the risk factors that the clients are presented with. If it's a refugee status, we know there's high risk of poor diet or food intake. And so you may have cases of increased malnutrition or underweight cases among the elderly and the children. And for this, you want to focus on nutritional supplementation and nutritional balancing of diversity of foods and so on. And the last bit is assessment of risk of fall or injuries. And this I had explained first in the medical and surgical case where we are saying because of the settings and the environment, there's high risk of injuries. That is physical injuries, and some may come with fractures, others may come with very secondary wounds, which may take a lot of time to heal. And for this case, you want to be vigilant enough to assess the patient holistically. So it's normally actually advised if you can do a holistic assessment of the client, including both physical assessment, mental assessment, psychological assessment, and also spiritual assessment of the patient. So that when we are putting the patient into care, we are able to incorporate holistic approach that will cater for each and every aspect of this patient, from both medical treatment to mental stability to spiritual understanding, and you can have the emotional balancing or social aspects of the patient catered for. And these are a few policies that I thought are a bit key if both of us could know on how to handle the vulnerable population, a few policies that can guide us on how to go through when you find ourselves in such a setup. And one of it is said to we need to prioritize certain populations, and this is the elderly and the children, where they say the elderly and the children should be prioritized and given all the necessary care. So like in a population where there's high risk, then children and elders should be prioritized first. I think this is because of their risk in terms of immunity, their level of capability is also very low, not only of taking care of themselves, but also settling down or being able to adapt to a new environment. And then the other bit is whereby we are advised to have an established referral system. And in the referral system, we are looking at ability to have better facilities linked up to the centers that we are working in, so that you can refer clients to better facilities, more modern facilities, in case the condition worsens and demands further treatment or care from the center. And it's advised also to ensure there's proper training and skills for the staff who are taking care of the high-risk population. That as much as it's a vulnerable setup, the team providing this care should be well equipped, trained, and have the necessary skill to take care of high-risk patients. And the fourth, sorry, not last, there is need for close monitoring, so that not only the vulnerable population are safe, but also to minimize risk of abscondment. You need to appreciate that this is a crisis setup, vulnerable setup, and majority of the people are not able to take care of themselves in such environments. And so you don't want to have this poor monitoring system where maybe someone have a mental breakdown and they're not able to bear on what is happening. Some of them may actually run off or run away, and that is a safety risks. And so for that, have to have good close monitoring for the purpose of safety and improving care for the client. And the other policies that could be in place is ensuring that there's safety not only for the patients, but also for the healthcare providers. We understand that these are high-risk places, these are highly vulnerable populations and settings, and therefore you don't want to focus more on the patient and forget the healthcare provider. So the safety should cut across, that is, provide for both healthcare providers and for the patient. This could be maybe providing bed rails, mobility needs, general security systems, and monitoring systems that can ensure that the data, the healthcare safety physically, and the patient are protected enough. And number 6, need to respect also autonomy. And in this case, it's good to seek consent for each and every individual case that you're handling. And on discharge matters, it's good to discharge patients with a follow-up plan and advice, so that you don't lose the client into follow-up care, maybe because the situation got worse and they moved to other places, or the patient got worse at home and complicated and ended up in death without being aware of what's happening. So it's good to have a follow-up plan and an advisory diary or follow-up system. And lastly, number 8 is to have a patient documentation policy. At least each documentation should be clear enough so that it can be understood by the team in place or the team that is working together. And this will help us ensure that we have captured each and every detail of the client without exempting necessary informations. And so appreciate that we have nurses who work in these environments, and there are several roles they can play in ensuring that they are able to provide care to the vulnerable population or vulnerable settings. And part of the roles could be working around to improve on the existing services, coming in, let's say, like health policy makers, or coming in as advisors and a technical team to just come up with mechanisms and approaches that can make the work environment better, or can improve on the services that are being provided. The community health nurse can also advocate and provide networking channels for the different services that are being provided. Remember, we've mentioned referral system, and part of this referral system can only be advocated for, but also networked. And this is creation of community system, community links, and bringing in partners that can come together to boost up the services that are being provided for the population. And then the other bit is practice of culture sensitivity, appreciating that as we work in the vulnerable setup, sometimes you maybe find yourself in a very new locality that is different from where the person is used to, especially the health workforce, and it can be difficult on how to let's say adopt to that. Giving an example of the Dadaab setup, which is like the biggest refugee center at Kakuma, whereby you have population from all sorts or all sources of background. So with such, you need to appreciate that you're working with different people who have different beliefs, different culture sensitization. And for this, the healthcare worker or the nurse has to really adopt and provide services that are culture sensitive, that will also not clash with what is happening on the ground, with the beliefs of the population, and so on. And the other bit is work with the community members, more so when it comes to community outreach. And this marries a lot with the culture sensitivity, because you are in a new population. Culture is very diverse, and members may want to be respected based on what you already believe, and you need to learn of their belief system. So if you want easy entry or community entry with the members and easy mingling, then it's good for the healthcare providers to merge together with the community and be able to come up with outreaches that will not only break myths and misconception, but it will also demystify any beliefs that they might actually be thinking the healthcare workers are breaking on terms of their cultures and beliefs. And the other bit is being unique in the method of healthcare delivery. And this marries again with culture. So you need to appreciate that there's the standard way of providing healthcare, but sometimes, because you're working in a vulnerable population, the belief system could be so strong, and at this time you may be forced to, or you may be stimulated to think of new ways that are unique enough to meet the demands of the care, but also to incorporate the culture diversity of the population that you're taking care of. And the last bit is working around to come up with more effective information tracking system. Remember, this is a high risk population, and the risk of abscondment is also very high. So if you're looking at reducing abscondment, reducing risk of safety, of injuries and other safety related issues, then good information tracking systems are very good. So these are few roles that the community health nurse can come around and contribute to this. There are more, and you can add more to the list, but there are basics that you can look into, like providing nursing care services, research, management, and leadership skills. All these are also part of the roles that the community health nurse can come around in caring for the vulnerable populations. And that was it, guys, for the case of management and taking care of high risk populations, e.g., the vulnerable population. And if this is your content that you love, kindly give us a like, subscribe, that is, click on the subscribe button, and be with us in our sessions as we teach and learn more concerning healthcare. Thank you so much, and see you in our next sessions. Bye bye.